Hello. We are trying out live over here on TikTok. I don't see what this is. Hmm. Welcome in, everybody. We're going to talk about a little bit about measles, a little bit about the updates. And one of them is kind of sad because with the measles cases, we are unfortunately losing people. Yeah, we are losing people. So there is that. Let's see if I can get my camera up a little bit for you all. And I need to share as well. Let's see if I can share it with my other people. And then they can come over. All right. Welcome, everybody. I hope you can hear me well. I'm trying to make sure the audio is good. Let's see if I can send it over to the other side. Okay, so we're going to be on for about 30 minutes. We're going to talk about measles. We're going to talk about all of the things that are plaguing us right now, should I say? Yeah. And the fact that my hair is doing all kinds of things. But let's see if I could just get it out for today and have a conversation with you all. One of the sad things is that in Pennsylvania, they have reported and recorded 2 unalivements from measles. I don't know if people understand how important this is, monumental, because one thing that people have misunderstood is that measles is not that bad, right? First of all, it is bad. Second of all, we have been a long time without it, and now we have it back. It's a very contentious topic, and let me see if I can get my it looks like I can't. Let's see if I can share it. But no. Let's see if I can go into my other. Oh, there it was. Okay. Let's see if I can share. I'm troubleshooting for the first time with this app. Bear with me. Bear with me. Bear with me. Where is my ability to share? No, I don't want that. I'm going to go in on my other account and see if I can do it that way. And okay, I think I see what it is. I see me, but I don't see the ability to. I see what it is. I see. Okay, I found a way to share it. Okay, I found a way to share it. Let's see if I can go back to TikTok Live. And I'm probably going to go simultaneously live on the other side. Hey, two people. Welcome in, welcome in, welcome in. We're doing a test run over here on TikTok, my first time going live on YouTube. And I want to try it a little bit differently than I do for TikTok so that people can be part of the conversation. And I have some updates. So what I normally do on the other side is I talk about updates in the health, and one of them has been measles. And then I talk from a pathology perspective, testing. What does testing look like for measles? What does testing look like for a lot of things? The pathologist is the doctor's doctor, so everything that happens at the laboratory comes through us. It comes through us. And I like to have a conversation from a way people don't have. I talk about cancer diagnoses. I talk about laboratory tests that you may or may not know about, and more things. So that's what we're doing today. I'm also going to try to go for my TikTok for those who are over on that app. But I want to start doing YouTube. I like YouTube. The Medical Collective podcast is the podcast that I host, and we're over here on YouTube. Go to the Medical Collective podcast. You can see all of the conversations with Dr. Dan, Dr. Tucson, all of my, let me do this to make this easier. All of my friends are over there. That's much better. Yeah, so that's the way you can get in tune with us a little bit better is listening to the podcast. And the most recent episode of the Medical Collective podcast came out about public health as a national security issue. Very, very good. But one of the things I wanted to talk about was the measles cases in Pennsylvania, where there have been an additional 400 cases and 2 people unalived from it. 2 people unalived from it. That is what the discussion is. The way you can engage is by getting in the chat. After a few lives, I'm going to start doing it to where being part of the chat will be a feature for subscribers and all of that. And listen, I have a lot of information. I have a lot of hosts, co-hosts of the podcast that I want to bring on and other guests, and they're all experts in their own right. And that's why I call it the collective. And if you haven't seen, y'all go over to Don Lemon, you'll see that I was on there talking about the autopsy initiative. I was over there talking about autopsies in general. So if you have questions, general questions about autopsy, forensic, I can help you. I am not a board certified forensic pathologist, but I am an anatomic and clinical pathologist, so I can talk about things like that. We also can talk about lab tests in general and cancer diagnosis in general. So shout me out in the chat. I'm gonna go over to my TikTok at the same time and see if I can go live, just so that we can have both intertwined at the same time and get some of them over here on the YouTube. So welcome, YouTube. How are y'all doing today? And anything in particular you want to discuss, any questions that you have, bring them in. Bring them on. Listen, I am a very laid-back, friendly person, and I love to teach and explain. I do. I haven't been growing my YouTube, and that's partly my fault. And I'm not new to this. Let me say that too. A lot of people may say by my face. I am in the 40 and up club. I'll just leave it at that. And I also have been practicing for over 16 years in different avenues and venues. Yeah. Okay, so I'm gonna go live over on TikTok and see if I can get some of the TikTok people to come over here. Let's see. I've got to change my camera. And I don't know why it's brighter from over there, but that's okay. I'm gonna add a little bit of light for my other side. I hope it doesn't bother you guys too much. Okay, that's good. That's good. That's good. So welcome in, welcome in. How are you doing, YouTube people? I'm gonna go ahead and go live on the TikTok side too, and that way I can go into some of the conversation that I wanted to have today. For those that don't know, I love to show pictures, so I am gonna start showing you guys pathology. Pretty cool stuff. Yeah, pretty cool stuff. Hey, dude. Hey, Do over on the TikTok side. How are you? How are you doing? Hey, Carolyn, how are you? Welcome, welcome, welcome. So I am trying to dual stream. I don't plan to be on here long. I will tell you all that, but I do plan to go through some cool stuff and talk about what's been in the news. Yesterday, we touched on Iowa. If you live in Iowa, you will know that what is big on your big for the elections will be cancer. Because unfortunately, you guys are having a lot of cancer cases, it should be something that you bring up with your constituents. Yeah. And how are you, Carolyn? So, Carolyn, I'm streaming over on TikTok, on YouTube at the same time, and trying to get people over there. If you're in the Dr. K Live Alerts group, do me a favor and see if you can. Let's see if I can even put this in the comment section. Do you guys see this? Go on over there and follow me over there and follow the Medical Collective over on the tube. So we have two accounts over here, the Medical Collective and this one. I had 3 people in here, and I don't know what this means. There's like a camera, but I don't have access to that feature. I don't know what that means. But I'm trying it out. Boxer Mom, hey, try going on over to the tube, and we're gonna try it out. Yeah. So one of the things that happened today was that they announced 2 deaths in Pennsylvania from measles, one of the most preventable, vaccine preventable illnesses that we have. And we shouldn't in this day and age be even discussing it. So I wanted to get on to talk about that, as well as some other things that have been stewing around. But that's been one of the big ones. And I get a lot of my stuff from several sources. One of them is KFF, one of them is CIDRAP as well. Yeah, and so measles related unalivements mark first 2S fatalities this year. This year. Yep. And let me try my board too for you all over here. So I am simulcasting right now, Blind Psychologist and Lisa and everybody. Hey, Dr. Cleta. So I am over on the tube. If y'all can do me a favor, I put the link in the chat. Go and follow me over there and follow 2 of us. Follow me and follow the Medical Collective. I have 2 channels. I am growing my YouTube channel, or trying to, and I would appreciate the follow. Let's see if I can pin it. Yeah, it allows me to pin it. So that's where I am. So make sure that you do come over to the tube. I'm setting up there. I'm going to try the multi-streaming thing, but it's kind of difficult, I'm going to be honest, because if you don't have a stream key for TikTok, it doesn't allow it. So I'm streaming YouTube right now. And hey, to the person over, and thank you for the like. Thank you for the thumbs up. Okay, so the article I'm talking about comes from CIDRAP. Hey, Trini Gal. Oh, Trini Gal. Okay, I will not say your full name, but welcome over here to this side. So Trini Gal is over on the tube. Y'all, come on over there. Come on over to the tube. It's actually a different view too. I kind of like it. I don't know, y'all. I think I might like it. If y'all all come over to the tube, it might be one of my regular homes. If I could get a stream key, that would be even better. But they're trying to get me to get the stream key. Yes. Hey, Diava Talks. So the news is this. Let's see if I can get it as a sticker for you guys. I had it, but I don't know if I have it now. Yeah, so let me take a picture of it. I'm going to send it to you guys. Okay. I'm taking a picture of it so that my friends over there can see it. And it's really sad. I'm going to be honest. It's really sad that in this day and age, we have people unaliving from something that is preventable, that is completely preventable. It hurts my heart that we're having to talk about the measles and people dying from it too. In Pennsylvania, is anybody in Pennsylvania in the chat? I don't know why it's being slow. There we go. Okay, so this is what I'm talking about, you guys. Measles-related deaths in Pennsylvania too. All right, CIDRAP. If you guys do not know about CIDRAP, I put it in my notes all the time. And also, if you go over to the medicalcollective.net, you'll see it. You'll see CIDRAP as one of the sources I talk about. They have the Vaccine Integrity Project, and it's a very important project that is working on reshowing and being very clear and concise on research around vaccines being very safe. Let me just say that. But I'll tell you what is not safe. Measles is not safe. It is not. And we have right now 2 individuals that have unalived for the measles, the first US measles fatalities of the year. Breaking my heart, breaking my heart. How do y'all feel about that? And for those that want to, I'm over on the tube. Come join me on the other side. It's a lot easier, I'm gonna be honest, because TikTok Studio is not the easiest. But this, Kate, we gotta talk about this. If y'all could tap, we are still over on TikTok. They like for people to tap the screen. So we have to get to 10,000 likes so I can continue over here. And we got 10 minutes to do it. So let's get to 10,000 likes. And then over on the tube, let's interact. Right now, you can interact in the thing. Thank you for those. Hey, Dr. Fleta, what's up? I love that. So I'm seeing some beautiful people over here. And then also, you know, this camera is so wide that it is showing stuff I don't want to show. I need to see if I can zoom in. Yeah, I'll figure that stuff out later. We will figure that out later. But welcome in. And yes, this is what we're talking about today, the fatality. So let me tell you a little bit about the people. Both individuals that unalived. Hey, Dr. Rael, how are you? I'm co-streaming, y'all. I'm over on the tube. So both people that unalived, both of them, this is actually very sad, I'm going to be honest. Both of the people that unalived were unvaccinated, and they resided in Lancaster County. I'm not sure what the demographic there is. You know, these people don't immunize. I'm not sure. But Pennsylvania, you guys, has been hard hit. They've been having a lot of cases in particular areas with measles. Both individuals were a part of this outbreak of 185 cases just in 2026. This surpasses Texas's outbreak. I'm sorry. Okay. This makes this one of the largest outbreaks in the United States this year in total. I'm not sure, actually, I'm sorry, 2026. So Texas's, I don't remember how many we had. I think we did have more. So in total, Pennsylvania has had 393 cases, the third highest fatality, the third highest tally in the country. They're not going to give much because they want to protect the privacy of the individuals. Pennsylvania's health department will not release additional details, but measles is reportable. So we're going to know the unalived. We're going to know the unalived. I mean, yeah, Pennsylvania, Dad. Dad is not a noun. Is Dad a verb? Is that what it is? Hi, Health Hub with Dr. T. How are you? I don't know. Is it a verb? Yeah, so we talked about, thank y'all for those tapping. We already have 1K. Let's get up to 10K, 10 to 25K. And on YouTube, thank y'all for just being here, being part of the new YouTube family. We have Fleta and Delarue Tro. I know who that is, but thank you for coming over there. You had great questions yesterday, by the way, great questions. There was 3 other people on here before, but I kept toggling back and forth. But I got it. I actually like it. So I might come back again tonight just on the tube. Just on the tube. Okay. 3 decades. 3 decades. More than half of my life. 3 decades. On this green earth in the United States of America, we have been measles free, y'all. We have been measles free. It had been eliminated. And now we are about to end August. And I don't know if you guys know, there's a committee meeting to talk about the elimination of measles in the United States of America, and we're probably going to lose it. People are not familiar with the disease and don't fully understand the severity. And I wonder, and I want to get y'all's thoughts, if these two unalivements are going to put more perspective. Is this going to be it? Because to me, when we get to the part where people are unaliving, it's heartbreaking. And it's heartbreaking when you hear people unalive in car accidents, when people unalive in, school pew-pews. But when people unalive from something that for 30 freaking years has caused no harm, the people are now unaliving that because of the poor leadership, the poor planning, the poor messaging that has been happening. It breaks my heart. It breaks my heart. So we don't even know, you all, the particular names. They don't want to give demographics, but the majority of people that have been getting sick from the measles are children. They are children. They're our babies. So thank you for reposting, Shauna. MedPro, thank you for the hat and mustache. Thank you. I appreciate that so much. And how's everybody doing? I know y'all didn't want to hear this today, but we have to talk about it, and I wanted to talk about it in a medical space. And this is the space that we need to be discussing it. So if you can, tap and share with somebody that should be part of this conversation. Let's see, I'm going to share it to my stories. And I'm over on the tube. So come on over to the tube. I have 2 people that were over here. If you come on over, I'm going to put the link. The link is in the chat, but it's been a minute. So let me re-put the link. All you have to do is come over to my personal channel, Dr. Keisha Davis. I have a YouTube channel. And then go mosey on over to the Medical Collectives and follow it, because that's where all of the podcast information is at. All the podcast information, all of it. If you want to actually look at the video, or you want to go see what Dr. Dan looks like, since we don't have him on, go over there. It came out Monday. It came out on Monday. Okay, let's see if I can find the link again. I think it was way up there. My. Okay, I found it. If somebody could copy and paste this too before it goes out, that's where I am. Just come over and follow and subscribe. And also over on the Medical Collective on the tube. I would appreciate it. This is how I grow. But I am going to start trying to stream here on the tube and not so much over here. So if you want to know when I go live, right now on my own little group here on my profile, Dr. Keisha Davis. If you look at my homepage, my profile page, you'll see a bunch of tabs going across. There's one that's a group. And in the group, it's Dr. K's live alerts. That's where I've been putting when I go live on other places too, like Noon Vibe and stuff like that. Mm-hmm. Yeah. Thank you, Dr. Fleta, for going over there. Appreciate it. Yeah, that's what I'll do. And, as more stories like this pop up, one of the most important things is, can you get tested? Okay. If you want to know if you are immune, if you are good, you know what you do? You go over and you ask your doctor if you're concerned about a measles titer. It's called an antibody titer. That's a blood test. They're going to take your blood and they're going to check to see, okay, you're immune to, your antibodies are up. Now, there are multiple ways that you're immune to something. Your B cells are the ones that produce the antibodies. Thank you. And your T cells are the ones that also can develop memory and be prepared for next time. But the problem is that we don't have clinical, yes, on the research side, but we don't have clinical tests that are good enough to be used as far as T cell testing. Right? So we don't use that at all. And it's hard to standardize it. But antibodies is one way. So you could technically have a low antibody count and still be immune, but they're probably going to recommend that you get the vaccine if you are eligible to get the vaccine again. But most people that have had it, most of us that had our childhood series of MMR, we're straight. You are forever. Now, people will ask, well, why is it that I have to get C19 every year, but I don't have to get the MMR? Because they're different. They're different. In addition to them being different, certain viruses, like RNA viruses, like to change a lot. They like to mix it up. And because of the shift and the way they change, we have to keep updating the immunization because we have to be prepared for them. Some viruses are more stable, and measles is one of them. That is still stable enough to where the component of it is the same, so the vaccine's going to work. Thank you, Amy. Thank you. And those that don't know, I'm over on YouTube right now. Excuse me, the tube. And if you want to, it's my own Dr. Keisha Davis on the tube. I also put clips of the stuff I've been doing with Don Lemon and TMZ. And hopefully, again, here it is. If somebody could copy and paste it, that's where I am right now. And the Medical Collective has been over here. That's where I release the videos. So I am working actively on getting my accounts up so that I can get sponsorship. And the way that you can do that is by helping, by commenting, and by sharing and subscribing. So thank y'all. I hope by the end of this, I have, well, there's 10 of y'all, I have 10 more subscribers over on the tube. And over here. So this is one of the stories we're talking about. Measles-related deaths, mark up to 2. And you know what? I'd love to have y'all come up and have the discussion over on TikTok. I don't know if I can do it over on the tube, but over on TikTok. So let's talk about measles. Let's see if I can get this thing smaller. And then I'm going to get rid of this because the wish queue is never used anyway. And it takes up space. I don't like a lot of stuff. It's too much. Yeah, so this is measles. Can y'all read it? It's tiny. I think I made it too tiny. Yeah, but I could cut some of it off technically. Maybe I'll put it down here. No, that don't look good. There we go. So questions welcome, questions welcome. Did somebody put a new, you just read, yeah, 393. Yeah, that's what I was just going through. Over 393 cases, data is not announced for 2026. And we're a little over halfway through 2026, which is sad. And 2 people unalived. 2 people unalived. They're not giving more information on those people that unalive from it, you know, or their status. People are gonna be like, oh, were they really, really sick? That doesn't matter. People should not be unaliving with measles, and we should not have over 2,400 cases of measles in the United States of America, when for 3 decades we hadn't. We had not. We have 2 unpreventable unalivements. YouTube people, evidently over here on TikTok, there's words that you can't use. Yeah, so, but that's another thing. Over on YouTube, we can have the regular conversations. And hopefully y'all come over there. And hey, beautiful 15 people. We're talking about measles unalivement. If you want to come up, you're welcome to come up. I do like to do one at a time. I kind of like to keep it like that. And I like for you to also have a comment or question that is pointed. Let me say that. Yeah, I would appreciate that. And this is not my normal time, but I wanted to talk about this because this is really bothering me. Shout out to the 3rd person that has come over here on it. Thank you, guys. I appreciate you. You know, it's weird though. Like, you can't see who technically is on. I don't know. I'm gonna have to figure out the YouTube. I can see when you chat, but I can't see when you do that. And Trini Gal says, I read pathology reports every day for coding. Thank you. That was so beautiful. Thank you. Okay, so then my question is for the person that reads pathology reports. What What do you like or don't like about it? Or what do you think people maybe need to know about our reports? That's the question I would like to ask you. Because I know that you see a lot of terminology, and you probably understand it more than most. I'm sure. Yeah. So, anybody else about the measles case? Anybody have anything to insight? I know a lot of us are probably just in shock right now that we're still having to talk about this and that nothing's really, changed, especially when part of the executive orders was to separate it, was to not require schools to have immunizations, and was to make it even harder for accessibility to immunizations. In the midst of this, if this is not going backwards, I don't know what is. This is not even walking backwards. This is running backwards into a wall. Thank you, Dr. Vial, for that. That was pretty. This is walking into a wall backwards, is what the United States of America is doing with us. Now, you guys do remember when the Air Force Base, and I think it was in Texas too, right? The Air Force Base in San Antonio, was it, or Austin? The Air Force Base that had the new recruits, and they said you don't have to take immunization. So, let's fight for the cause, my body, my choice. And then the whole unit got the flu. And then what happened? A person unalived from the flu, a new recruit. So we're talking about a 20, 30-year-old, a young generation unalived from preventable illness too, because severe flu, hospitalized, unalived flu cases are prevented by getting the flu vaccine. Studies, data shows it. And then all of a sudden the administration, hey FloJo, decided, okay, we're going to require the flu again because somebody unalived on their watch because of their decisions. And now I hope something happens on this side, because 2 people, which I'm sure were under 20, unalived from measles. Loxie said, as adults, how do we make sure we are protected? Well, if you know your immunization status, that's the biggest part. If you are immunized, that's another part. If you have children, making sure they're immunized. And if you have loved ones, talking to them about the importance of immunization. Using your circle and your influence around those people in your circle is important. And then if you happen to need to be on chemo and stuff like that, you have to know you're now at risk, right? Because your immune system is different now. And if you're around people that don't believe in immunization, you have a chance of getting sick from them. And let's not forget, what is the Maryland Department of Health? Dad is not in now. Oh, okay. Yeah. So here's a couple of places. I think I put one of them last time. Was it health.gov? Let's see if I can find it for you guys. There is a new place that does it, but Johns Hopkins had a measles tracker. Let me see if it's still active. I just released some filtered comments. They had been doing a good job, and then CIDRAP does a good job with wastewater testing. Okay. So let's see where they're at. They're at 2813. Now, CDC has been 2 weeks kind of behind on their actual reporting. So if you are, for instance, in a county where there's an outbreak, your local health department is giving you better data than CDC is. So Loxie, depends. There was I think it was 50, 57 at your age, there was a period of time where people were getting a vaccine that was less effective than the vaccine after that period. So it has been told, if you are in that period of time, that you do talk to your doctor and you may need to get it again. But for the most part, most people do not. MJ Rod fan, are you serious? Ah, all right, somebody fact check that and see out why. That's really sad. Yeah, if you can let me know the time period, Loxy, I can let you know. But the county, your local health departments and your state health departments are your best bet. I'm gonna be honest, are going to be in your best bet. So I'm looking right now at the current situation with measles to the Johns Hopkins tracker. Spartanburg, South Carolina, had one of the highest in 2025 at 330, and right now Lancaster, Pennsylvania, that I was talking about, has in the past 2 weeks 48 cases just by that, and 180 in 2026. But we know that's more than that. So that's what I'm saying. There's like a lag. And then Texas was high in 2025. Yeah, but not so much now. Utah, Central Utah, Collier, Florida, 93 cases. Mojave, Arizona, 216 last year. The recent 2 weeks, I'm not seeing a high. Yep. So that's where we are with the measles cases. Anybody else have questions? Yeah, Tina Purple. The CDC not having a director currently is the problem, 100%. Well, Loxy, you know what? I'm glad. Was it a preemie? Was the baby a preemie? Yeah, because usually it's 2 months. But you imagine, you guys do know that there was a baby that the first 2 months they don't get the MMR, right? They're supposed to get hepatitis, we know, and they should get that. But when they go home, those first 2 months when you guys want everybody and their mama to come see your baby and kiss on your baby, you now have people that may lie about their immunization status, that don't think it's important, even though they may not mean harm, they're just foolish, and they're touching your baby and they're carrying a unaliving deadly disease to your child. All right, so your baby gets measles. Baby gets better from measles, and then 9 years down the line, said child develops lethargy, unresponsive, and you take them in and find out they have something because of the measles they had 9 years ago. It's called subacute sclerosing panencephalitis. Shout out to the measles. And then also, somebody gets the measles, and then later they're like, well, I'm immunized. Why am I now getting this other disease that I know I'm immunized against? You know why? Because measles causes an immune amnesia. And things that you may have been even exposed to and immune to, you no longer are because of measles. Data is now, that's very important. Now, there's some data that's still there, and this is why a lot of people, this is where I go through CIDRAP and Johns Hopkins, they know which data to take and not take from the CDC. Yeah, that's the thing. Thank you for y'all getting me over 10K. I appreciate it. And y'all are welcome to come up. Welcome to come up and ask questions one by one, of course. Keep the conversation or put it in the chat. That's fine too. Hey, T-Dub. Hey, Andrews. 1977. Is that your birthday? Because you're close to my age. And hey to my Tube of You people. Those who don't know, we are over on the Tube of You. I got to scroll all the way back up in the comments. If you scroll all the way up, literally halfway down, well, a little down, now I don't see it. I'm looking for my link. Does anybody see the link for the YouTube? It looks like it's gone. So I'm over in the Tube at the same time, and y'all are welcome to come over there. I don't even see that link anymore. If somebody could repost it, I would appreciate it. And Stacy, I don't see I think your comment was muted. I'm telling you, sometimes they do interesting things. Yeah, I can't even get the link back. But it's Dr. Keisha Davis over on the TubeU. And I'm starting to migrate over there. So come over there and follow me. Hey, Tori, thank you. Thank you for the heartmeat. All right, we have a person requesting up, Loxy. I kind of like that name. I kind of like it. It's interesting, though. The tube is a horizontal format, and then it's vertical here. I don't know which one I like better. Hello, Loxy.
Accepting my request. My question, I guess, regarding the MMR vaccinations. When I had my daughter, it was in 93, and I know you said that at one point in time they weren't as foolproof, I guess, and when was that? I guess we didn't discuss that.
I think it was 50 to 57. I'm checking
okay.
I'm checking.
So that wouldn't have included me, but my mom wasn't I guess the greatest parent. I guess I loved her, she's wonderful. But it could have been that I didn't get the vaccination. But I was surprised no one told me that I was being tested for a titer or anything when I had my daughter. A nurse just came in and said, hey, I'm going to give you your MMR vaccination. And I'm like, what? I'm like, haven't I had that? And she said, well, if you don't take it, I wasn't resisting it because I get all my vaccinations. We believe in science at my house. But I was just surprised I hadn't had it, and I took it. But I never did follow up in asking them, how they knew that I didn't have it. Is it normal to do titer? Do you know?
They probably did that. They probably did that. It's if you request or something. No, they're not doing MMR titer on everybody. But if you told them you weren't sure, they probably did the MMR titer.
They didn't tell. We didn't ever discuss it at all. So I don't know what happened. I'm not angry about it, but I was just curious if they did that on mothers, and I wish they could, but But then, also my daughter would have been around her dad also, and you can't test him. But anyway, I thought it was interesting, and that was my question, I guess, about it.
Yeah. So you said you did get it. You did get the titer.
Oh, I guess they did. They knew I didn't. I mean, they told me that I needed it, that I couldn't take my daughter home. So I just assumed they did a titer because I don't know how else they could have found out that I didn't have it. Right?
Yeah, I'm glad they did though.
Yeah, me too. So I know that I've had it. I know that I've had the immunization, but it was 30 something years ago. So then I do have health problems, but given that it's that long ago, I'm still protected, right?
You should be. I would again check with your doctor. There's always extenuating circumstances that can make you less. But if your MMR titer now is good, your measles antibody titer, then more than likely there's a chance that you're fine. But there's always this rare, chance that your immunity may not withhold everything. But the over 95% of the people that have measles right now are unimmunized, and then the 2 people that unalived were not immunized.
I've been able to fight other viruses and things that I've gotten from my grandson who just turned 5. So I keep him alive, and I've been able to fight viruses very well. I'm not immunocompromised or anything. I have other health problems. So do you think people who are just immunocompromised should get a titer, or do you suggest everyone speak with their doctor?
Speak with their doctor. Mm-hmm.
Okay.
Yeah.
I'll do that at my next physical. So I appreciate you.
You're welcome, Loxy. Thanks for coming up.
Thank you. Bye-bye.
Bye. I think I figured another way to do this, y'all, at the same time. Can you guys on YouTube, could you guys hear her talking? If you couldn't, let me know, and I'll try to actually get the microphone closer. But I think I figured out a way to do it, so it'll make sense. Those who are over on TT, is anybody in the Dr. K Live Alerts group? Could you guys get the link? Or if you went over to the tube, and hey, Healing, how are you? Could you, someone repaste it into the TT chat, the TikTok chat, so people that know can come over to the tube. And make sure you're following, putting the thumbs up too, the meaning liking the live, and the little emojis, doing the same interacting that you do over here. I appreciate it. We're talking about measles and the people that have unalive from it, and immunization. Immunization is important. Checking your titer, you can do it. Getting another one is not going to hurt you, and you can do it, especially if your insurance covers it. And right now, y'all, with the way the case count is looking, it's not looking good. And we're just a week or two into school. Some people haven't even started yet. My daughter's in her second full week. And I don't know. It's not looking good. It's not looking good. So any questions or comments about this, how you guys feel about the way that this administration and politicians are framing it? And you're not going to hear them talk about it either. But ask the question. 2 people just unalive from measles. How do you feel about that? Ask them the question. All right. Anybody want to come up? Thank you. Anybody want to come up? You are welcome to come up. I saw somebody in the request and then it went away. Yeah. And if you're on YouTube, you can put your question in there. So you can hear me. You could hear the person that was talking. Shout out to the people over on the tube too. Thank y'all for coming through. I appreciate it. And I might come back over on the tube later. So there's that. We'll do an hour, so we get about 13 minutes left on TubeView. And anybody over here, anybody over on TikTok, y'all, yeah, this recent article just came out about the 2 cases today, that the people that died from the measles. This is unprecedented, and these are the first 2 deaths of this year of 2026 from a preventable illness. So that's what I really wanted to talk about. There are a few other things that have been kind of brewing. One of them is Mpox. We don't talk about it enough. And the question is it endemic, meaning here to stay? And possibly so. Now listen, we don't have high counts. If you go over to wastewater data, you don't see, it's not high enough counts of it to be concerned about it. Yeah. Also, this vaccine executive order, let me show you a good thing. Opposition to Donald Trump's executive order on childhood vaccines continues to mount. More than 210 medical, health, and patient advocacy groups have signed a letter, and they're condemning the administration's efforts to reduce the number of vaccines for kids and spread out the doses. The statement reads, "Families deserve clear guidance from federal officials that is grounded in science, evidence-based medicine, and aimed at protecting children's health. Instead, the White House released an executive order that undermines confidence in childhood immunizations and recommends changes that would leave children less protected and families more confused." Yeah. So I'm glad this is how we use our voice, and I'm glad that the medical community is using their voice to speak out against it. Completely appreciate it. Completely appreciate it. Thank you, Dad is not a noun. Thank you. Yeah, it's hard. Anybody in here have hesitancy? You know, we hear it a lot. I think there was somebody said that 3 out of the 4 immunizations, so they skipped one. Was it a family member or something? And I'm pretty kind, y'all. I try not to be pushy, about the things, but I do lead by facts, and I don't try to argue with somebody. If you have your mind made up, you have your mind made up. There's nothing else to do. If you guys can do me a favor, if we can get to 50K, I'd appreciate it. I think the taps went down. At least I made it to C5 because I was in D for a long time. TikTok. So if you guys can tap to get me to 50K, I'd appreciate it. I don't have my device with me. I would help you all. That way you can keep it going. If not, in 5 minutes, I am going to have to, in 10 minutes, I'm getting off. So let's get to 50K. The way that the live gets pushed out to others is by the more y'all engage. Alicia knows that. She's up here reposting, liking, sharing. Web, thank you for getting your heart me. All the good things. Our community tiered up. All right. Okay. Yeah, I just wish the numbers would tear up. Oh, you're on YouTube? Thank you, SB girl. Well, listen, stay over there. Yeah, the tube. I am appreciating the tube. Oh, and I didn't know you could tap on the tube. Is it the same thing? Also, there is a slow, I put the slow mode on. If you guys don't like it, I can change it. It says send a message every 1 minute. I think I did that because I didn't want like spamming in there. That's a thing that happens. Yeah. All right. So I don't even see Boxer Mom today. Hey, Southern Cali girl, how are you? Southern Cali girl, Justus. Hey, Justus, how are you? The story of the day, y'all, was this, which breaks my heart that we have lost 2 people from a preventable illness. And that's all I will say on that. Anybody else want to talk about it? Welcome. Also, the pushback from medical groups for the executive order that didn't have any data or science behind it is impressive. Yeah. And then someone had mentioned that, which is sad, that Dolly Parton passed away today. I'll have to look and find out what she passed away from. That hurts my heart. Everybody loves a Dolly Parton, right? Oh my goodness. Everybody loves Dolly Parton. Something else that we can talk about quickly. I'm doing like a lunchtime thing, I guess, over on TubeU or late night. Hey, Salty, how are you? I'm glad you're here. If y'all can collect your heart me and tap me to 50K, I would appreciate it. I would. Okay. So Cyclospora again. People are like, what's going on? Listen, Cyclospora keeps like the numbers keep coming and it's delayed. So say for instance, 2 weeks ago, they say we finally found the source. We found another source and we've gotten rid of it. If you still have the lettuce in your refrigerator and then you consume it, and then 2 weeks later, because remember up to 2 weeks it can take before you have symptoms of Cyclospora, the explosive watery diarrhea, then it could be technically be 4 weeks from when the actual contaminant was there. It's a very delayed thing, so it can be confusing to people. They're like, well, why it's still on the shelves? Well, technically no, but you're just now getting the symptoms from it. But what you can do is limit your intake of salad. Don't stop it because we do need people to start doing their vegetables, please. What you can do is realize that washing alone doesn't get rid of the cyst. And I did a whole episode on the Medical Collective. You can follow on TubeReview or Apple, Spotify, and listen to it on Cyclospora. Y'all can go over to the Kansas subsidiary of NPR where and listen to the audio that I did. Let's see if I can find this stuff. And my audio was not that great that day. I usually have my whole thing, but I was at a reunion and I was like, I have to take advantage of the opportunity. So the article is probably better to read where I talk about testing for Cyclospora. Now, say for instance, you go somewhere and you're like, okay, I went somewhere and I may have a parasite, right? You have this waxing and waning diarrhea. This is what you do. If you're going to see someone that may not be abreast on what's going on, and they're like, your fecal testing is negative, ask them, did you check for Cyclospora? Because normal fecal testing does not cover Cyclospora. And a lot of us don't know that, and that's okay. I think a lot of physicians know now to make sure they test it. So if they order your what is called fecal ova and parasites on your stool. That test in most labs does not include the special stains it requires to look for cyclospora. Cyclospora is tricky. So the traditional stain that we use to look for ova and parasites does not cover it. It hides behind it. It's a special acid-fast stain, and the doctor has to order it. If they don't order it, we're not testing for it. Also, some laboratories do the molecular test. It's like a panel, and most panels do not include it either. Yeah. So it's you're assuming when people say the test is normal, you need to ask what test are you speaking of, right? It's important to know what test they're speaking of and not just assume that it's covered. Okay. And Sarah Flynn said they heard the guest too. Okay, thank you. I'm just reading that. So that's the little thing about cyclospora. So cases are still rising with cyclospora. Sorry, it just is, and this is how it happens. This is unprecedented because every year we get cyclospora cases, usually 50 even in the place that's been hit the most, right? But this year, the amount of cases is substantially higher, substantially. And you know why I believe so? Because we used to have a cyclospora task force. We used to have a CDC where there was timely reporting. And once something reports, what happens? You take action. But if you now are dealing with a snail mail again and having to go step by step and not get an answer because there's nobody even in that department. We have ghost departments, by the way. Some departments, even the cyclospora task force, they said they're still there, but who's there? If you have one person now overseeing temporarily multiple departments and no action's getting done. So that's why I believe that we're having the amount of infectious disease we have. Recalls always happen, you guys. The amount of recalls technically is not more, but the amount of infectious recalls is. For instance, alfalfa sprouts, they have E. coli and salmonella. 2 people got both from the alfalfa sprouts, and some people are getting salmonella, some people are getting E. coli. But still eat food. Maybe start to shop locally at local farmers. Thank you, Saltaire. But I don't know to what extent. I don't know, you can trust that. Okay, the thing about the mpox I wanted to say is that, I hate to say the word CDC, but a CDC study does show that mpox could be endemic and spreading continuously throughout the United States of America. I don't know when there's going to be a point where they suggest immunizations either. Just a little bit. There's 2 families or 2 groups, what we call clades, clade 1 and 2. The clade that started originally in Africa is the one that spreads actually more, and it's not necessarily close sexual contact. It's the one that spreads even between kids, school-age kids, and it's the one that can be even more severe. That's clade 1. The one that spread in the United States of America was clade 2, and that usually was more in a certain demographic, right? More sexual contact spread, and not as serious, but more disfiguring skin lesions than clade 1. However, clade 2 has been causing some problems lately, right? It has been. But it's still nevertheless on the rise. And they said between 2024 to 2025, 70% of mpox cases in the United States were in unimmunized people from it. But not everybody's getting the immunization. There's that. There's that. Okay, I'm going to open to questions over on the TikTok. And if we can get to 50K, I'd appreciate it. I will let someone up now, and then every 5K, we'll have a new person come up. Anybody? Southern Cali, just does. Nobody? No questions from y'all? Amy, True Alpha, Trini Gal, and the coding questions. You better take advantage and ask them now, ma'am. You always have good questions, though. Thank you, Trini Gal, for collecting your heart. I appreciate it. Thank you, that boot. Thank you, T-Dub. Okay, Allie. Dr. Keisha, where's the best site to look up the recalls? You know what I hate to tell you, ma'am? The FDA. So this is the best way. 2 things I suggest y'all to do. Use y'all's shopping cards. If you go into Costco, If you're on Amazon, and I think some people have Amazon Market, we don't have that here. If you are going to Kroger, I'm Southern, y'all. If you're going to HEB, which HEB, I think they don't necessarily, but any place that has a card, use your card, your identifier. You know why? Because when you buy foods, even through DoorDash, they keep a track of it. And when there's a recall, you'll be able to see that. You'll get notified when there's a recall. That's, to me, the best way. Another way is this, is to stay up to date, and you can get a newsletter. So you type in your computer, FDA recalls. Okay, I'm typing it in as we speak to show y'all. FDA recalls, you could put food, but there's more than that. For instance, there's an eye drop recall right now for possible contaminant with infectious disease. I don't know this many prices, but a lot of things still use the FDA recall. And then when you go to FDA recalls, you can be on the alert. Let's see. Yeah, alert advisories. And go down and subscribe to get alerts. That's what I recommend if you really want to. I'm not trying to get bombarded with too much, so I don't subscribe to them, but I always follow all the news articles so that I see the recalls there. But that's what you can do. Yeah, is get on the FDA recall list. I know. So I know we don't trust them, but okay, another question. Is there a concern in a rise of CRS? What is CRS? If there's a decrease in MMR vaccine? Chronic respiratory syndrome? What is CRS, Southern Cali girl? Do you want to come up and ask it? You're welcome, Allie. And thank y'all for tapping. We already made it to 25K. We're halfway there. We're halfway there. And those on the tube of you, I appreciate y'all for coming through. We've had Dr. Fleda, we had Trini Gal, we've had Florinal Hughes, Sarah Flynn, all come over to the tube of you. If you haven't yet, take that link. Can somebody put the link? I can't do it when I'm live. I can't. I mean, I could, but I don't want to leave the video link. But also it's on my Facebook page. But if somebody could tap it, I would greatly appreciate it. How are you doing, Nurse Marie? Okay. Let's see, Southern Cali girl, I will invite you up to ask your question. And then when we get to 35K, next question. Hey, Southern Cali girl.
Hey, how are you?
I'm good. How are you?
Yeah, my question was about the CRS or congenital rubella syndrome.
Oh, okay.
Yeah. Like if you think we'll see more of it if there are less children getting vaccinated. I mean, because it could be so devastating. Heart problems, deafness, blindness. If the mother's exposed to measles.
I mean, pregnant persons in general need to be immunized, right? So this is when now an adult person is deciding not to immunize themselves, and they are putting their unborn children at risk. 100%. You guys do know also syphilis. Syphilis cases have been on the rise. It's been raining syphilis in the United States of America. But syphilis is another infectious disease, though it's not a virus, that passes vertically, meaning an infected pregnant person, even COVID, it crosses over the placenta and can cause heart problems, can cause brain problems, and even lead to a stillbirth. 100%. So of course we're going to see it. And the populations of people that don't believe in immunizing is where we're going to see it. Mama Millie said vaccination rates have fallen below the herd immunity threshold for measles. Yes, they have. Thank you, T-Dub, at Dr. Keisha Davis, and you'll see me live. There you go. Yeah, I'll move around the tube, y'all, at the same time. Yeah. Okay, go ahead. Southern Cali girl, sorry. Yeah, and I'm glad you brought that up, Southern Cali girl, because we need to talk about it in our pregnant persons. You know, I think pregnancy is one thing that's, unfortunately, sometimes it just happens, but we need to prepare ourselves. The way you need to prepare yourself, you need to be healthy and you need to be immunized. Go ahead.
How much do you see CRS that much in the United States, since we were, generally for the most part getting vaccinated?
You don't see it where there's not immunizations. It's been rare, right? Yeah. And but same thing with, I don't know if you know, I just mentioned the congenital syphilis. We've been seeing more pregnant persons passing that on because of this whole disinformation campaign. Mama Millie turned 60 and fully vaccinated. Shout out to you and happy birthday, Mama Millie. Happy birthday to Mama Millie. Yeah, I'm trying to pull up the statistics, but I don't know them specifically. I've just heard recently more about the congenital syphilis cases rising.
Knowledge is everything.
It 100% is. Yeah, CDC has a manual. It's interesting. The CDC will keep posted. It's probably because they don't know the stuff is still up there. Yeah, and it's when somebody's infected with the virus, you guys, not with the vaccine, that this stuff is hurting our children. Yeah, it 100% is. It's sad. Go ahead, Southern Cali girl. Are you still there? Did you have anything else you wanted to say?
No, well, it would just be so sad to see, an uptick in a lot of these diseases and conditions because of something that's so preventable. I couldn't imagine, because it's, the reason I was asking about the CRS was that the generation that I was born in, I think that time they just started coming with the vaccine for measles. My mom was exposed to measles when she was pregnant with me, so I had vision loss. But I had vision loss, and for a long time I didn't know that it actually had a name. What was going on had a name, and I don't know, about 15 or 20 years, I started reading. I went to the Helen Keller Foundation website, and that's the first time I had heard about congenital rubella syndrome. And I was one of the lucky ones because the outcomes can be so devastating, you know, and I would just hate to see that for something that's really preventable.
100%, completely preventable. The 2 deaths from measles, completely preventable. Congenital syphilis, congenital rubella, completely preventable illnesses. Completely. In this day and age, we shouldn't be dealing with that. Yeah. So sad. Someone find out why Dolly Parton unalived? Yeah, and happy birthday to Mama Millie again. Happy birthday, Mama Millie. And thank you for spending your day with us in the medical collective and Dr. K space. I appreciate it. Yeah, very, very sad about Dolly Parton. Very, very sad. Oh, and thank you guys. We're already at 32,000 likes. We're almost there. Thank you. Hey, Mary J. Not Mary J. Blige, is it? Yeah, go ahead. Did you have anything else, Southern Cali girl?
No, that was it. Thank you so much.
You are so welcome. I appreciate you coming through, as always. If you have another question and I'm still on, you're welcome to come back up and ask it. Any comments, you're always appreciated here.
Thank you, Dr. K.
All right, bye. Y'all make sure you're following Southern Cali girl. It just says peacefully, so they haven't put it out yet. Yeah, and they probably don't. I don't know if she had something chronic going on or whatever. Not all family members, just because they're in the limelight, want to share what their family members are going through. Even with former President Biden. Okay, so last year we already knew he had metastatic bone cancer, by the way. I wanted to clear that up. He's been known to have metastatic bone cancer, stage 4, right? Last year in May of 2025, that was announced. Now, what his son, and his wife have been alluding to is that maybe the amount of lesions or the further extent of the metastasis is increased. Yeah, same thing. But I'm glad that some people do share, because it puts, it brings more light to cancer and illnesses, and it shows that nobody's immune to them. Nobody. Now and even if they get it, they may get better treatment and access than us. But again, it's still sharing the story. I think it's important. Okay, since we're almost at 35K, I'm gonna let up True Alpha. True Alpha. You're a True Alpha male? What's that mean? And if you're over on the 2BU, I appreciate you guys. And they can hear over on the 2BU, they said happy birthday. I invited you up, True Alpha. Yep, everyone goes. Very true. True Alpha left. That's okay. Everybody that's in here, I want to say hi to you all. Southern Cali is real. Mary J, Mama Millie, the birthday lady, Nurse Marie, Nikki, how are you? Dad, Pinky Promise, Linda, T-Dub, Saltaire, Alexandra, Amy, all of you guys, Trini Gal, of course. And we do an open now until we get to 50K, and for the next 10 minutes, questions. And if you are not over on the tube, just go to @Dr. Keisha Davis and you find me, and go @The Medical Collective and you'll find me. What the topic has been, Israel, it's been multifocal. We've been doing updates, and we're getting people to go follow me over on the YouTube, because I'm going to start going live on there more and less here. And we talked about measles. 2 people on the live from measles. 2 people did. Hello, Boxer Mom. Boxer Mom, you know you're on here? Hi, Dee Dee. How are you? Boxer Mom. I don't know if she knows she's up here. That's so funny. Thank you, Zoe. Boxer Mom, do you know you're here? Okay, I'm going to disconnect her and see if she comes back up, because she may not know she's on here. That happens. That seems to happen. Mary J, same name. They're saying @Dr. Keisha Davis. Let's see if I have an MD at the end. Yeah, it's @Dr. Keisha Davis, no MD. So same. And The Medical Collective too. That's the one, that's the channel, my second channel that has all the information. So hi to y'all that are over here. Maybe we'll do a meet and greet over on YouTube in the evening time. I need to take my dogs walking tonight. I do. I need to take them on a walk. Oh, that's okay, Boxer Mom. Did you want to come up though? If you had a question, we're almost at 50K, and we're doing questions now. Thank you, Mama Millie. Mama Millie, that means a lot. I have 2 Dobermans, Mary J. 2 Dobermans. Okay, so update on Bella. Oh, thank you. Zoe sent 3 doggies. Those are the cutest doggies. Thank you. So update on the dogs. Speaking of dogs, and Zoe sent those amazing doggies. They're Dobermans, and the female had multiple lesions. One appears to be lipomatous. However, one of them had cells, and I looked at them, and I showed y'all the pictures, right? I showed you her FNA, that they're not sure what it is. It could be infectious, it could be benign, it could be malignant. So they recommended taking off. But when I went, I sent you like 3 messages, Boxer Mom. And the Dr. K Live Alerts group, y'all, on here. I try to keep y'all up to date. But they're not sure what it is and it gets taken off. But then Friday, or when I went, some dog was dying. And so I let him go. They sent a message. I just got the message. So now I need to figure out the timing, because as you guys know, with my son, I got to balance that with taking Bella in. And they want to do imaging and testing. Y'all, they're like $2,700. Yeah, for this surgery. And I think they want to take off more stuff, but I just want to focus on taking that lesion off. So we'll see. Your dogs are not cheap. And this is with dog insurance, which is weird to me. I don't know what kind of pet plan I'm part of, but that plan is not hitting it. Pet costs are crazy, SB girl. Oh my goodness. They are so crazy. Yeah. Oh, you had to go vote? Well, Boxer Mom, I'm glad you voted. But you guys are welcome to come up. You are welcome to come up and ask questions and type, because we almost at 50K. We're almost at 50K, but I did want to, after I went through, 2 people died from the measles today. Boxer Mom in Pennsylvania. We don't know the ages, the demographics. That's been sad. And other things, as the cyclospore outbreak is still growing, and we still have less people working in these positions. So there's that. It is Lancaster County, Nurse Marie. Lancaster County. Are you in Pennsylvania? Is anybody in here in Lancaster County? Yeah, because I get free dog visits. Like, we can go as much as we want, but then like the testing and stuff, I'm like, what is this? Yeah. What is this? It's a lot. And I actually was trying to go live today to talk about caregivers and those of us that are dealing with children and loved ones that are sick. But we'll have to come back to that. No, Lancaster County is where I'm sorry, I'm in Houston. Lancaster County is where the 2 people unalive from measles. That's what I thought you were asking. No, I got the dogs from my mom. So my parents have been big dog owners. Growing up, we had like 6 dogs at a time. We used to have like 6 American Eskimos because we were in Kansas. So, and they had that, they're the tiny Samoyeds. They're short with the big fur. We had like 6 to 7, sometimes 8 American Eskimos at a time. It was funny. This was before the day of fences. The dogs, they were not in a fence, but for the most part, they stayed in the yard. Then we had a Dalmatian. We've had Golden Retriever. We've had your gamut. Then when they moved into the area that's like close to the woods, then by the time I was in high school, we were more Doberman lovers. Once the American Eskimos died, we started doing Dobermans, and then the male and female had a litter, and that litter had like 9 dogs. All of them made it. So everybody got one. And I was going away with one, and she was like, why not just have 2? Let's keep each other company. And that's how I ended up with 2 Dobermans from my mama. Mm-hmm. Have a wonderful day, you too. And happy birthday, Mama Millie. Happy birthday. Yay. Y'all did the bomb. We almost at 50K. Okay, anybody, nobody wants to come up? I'm going to ask you, Boxer Mom, because you always have questions. And if anybody else, T-Dub, you've been rocking out, Trini Gal, ask away before we leave. Medical questions. Hi, Boxer Mom.
Hey, Dr. Keisha, can you hear me?
Yeah. Yo, we're almost at 50K. Thank you.
What's that?
I said we're almost at 50K. Yeah.
We'll get
So
there,
did you hear
Keisha.
about
I got my tapper on.
Thank you. Did you hear about the news about the 2 measles cases that died?
No, but that's so sad because it could have been completely preventable.
Completely preventable. Mm-hmm. Yep, completely preventable.
It is extremely sad.
Mm-hmm.
And I don't know when these other cases came out. They're not due to measles, though. But this couple had 2 babies that passed away from pneumonia as babies. But their religion said that that they couldn't get help for their children. And in Idaho, apparently, that's legal.
Okay.
Did you know that?
No.
So, anyhow.
Saltaire said they were not vaccinated. Strep pneumo is big.
Jeez.
Mm-hmm.
Dr. Keisha, what do you think about, I've asked you this before, I think, but it always makes me worry a little bit about if we get too many unvaccinated, what's the chance of the measles, can't think of the word all of a sudden, vamping into another version of the measles.
What do you mean?
And then,
I mean, mutation, but I think we talked about this, and I kind of did maybe before you came in. There are viruses, or specifically more RNA viruses, that do mutate more, right? But measles is a DNA virus, and it's one of them that does not as much. So not necessarily that, but some, yes.
So I guess that's the silver lining in it.
Yeah.
At least, that's helpful.
Well, I mean, I don't know if it is, because we have it. It's already dangerous enough. It's already more unaliving enough than other diseases. It's highly contagious, and it causes amnesia. So it allows other viruses to do what they need to do, because if you were exposed and immune to them and you assume you're safe and you get measles, then you lucked out. And people that don't believe in vaccinations aren't thinking about that, right? So they're walking around exposed to so many things. And it's not it's their children. That's where it pisses me off. It's children.
That's what irritates me, Dr. Keisha, because good and well, those people have the vaccines. They're just not getting them for their children.
Yep.
And it's frustrating. Every child to me.
Deserves access to vaccines. That was the episode.
Who are you to be able to make that decision? You know what I'm saying? Like, you could make your child blind.
Yep.
Because of measles. That happened to my mom's friend when they were growing up, because they didn't have the vaccine. And my mom got measles. And to this day, she has something in her eyes. I don't know. It's not that big of a deal, but they can tell she had measles.
Yeah.
It did something to the strength in her eyes, and she had to wear some kind of glasses to correct the whatever strength or something in her eyes.
That's sad. Gator said they'll immunize their pets, but not their children. Okay, y'all are on YouTube. Thank y'all for coming through on YouTube. I'm going to get off the YouTube channel. If you guys haven't, just at least go over there and subscribe to me. But I'm going to end the YouTube stream so I can focus on this. But thank you.